Hello, I'm Jack Dummer, a senior lecturer and physician in respiratory medicine at the University of Otago in Dunedin, New Zealand.
And I'm Lianne Parkin, a public health physician and epidemiologist at the University of Otago.
And I'm Josh Quon, a final year medical student at the University of Otago.
Along with some other colleagues, we undertook a study to explore the use of beta blockers among people with COPD and comorbid coronary heart disease. So why was it important to do this work? Well, acute coronary syndrome and COPD are leading causes of health loss and death in New Zealand, and they're among the most frequent reasons for hospital admission.
In New Zealand, clinical guidelines recommend that all people should be on a beta blocker, a statin, and aspirin following myocardial infarction to prevent further coronary events and deaths. And internationally, COPD management guidelines state that patients with ischemic heart disease and COPD should be treated the same as people without COPD, and this includes prescribing beta blockers. Despite this, studies in several countries have found that people with COPD and comorbid heart disease are undertreated with beta blockers. However, it was not known what was happening in New Zealand.
We used linked national health and pharmaceutical dispensing data from the New Zealand Ministry of Health to follow a cohort of patients with COPD who started taking a long-acting bronchodilator between 2006 and 2013. We identified patients who had an ACS admission during follow-up and explored the use of cardiovascular prevention drugs in the 6 months following that ACS event. We found that only 57% of patients were dispensed a beta blocker, while 81% received a statin and 88% received aspirin. We also found that there were differences in beta blocker use by severity of COPD and also by some demographic characteristics, as you will see in our paper.
In conclusion, the use of beta blockers in this cohort of patients with COPD was much lower than expected based on findings of general audits of ACS management in New Zealand. Conversely, the proportions using aspirin and statins were similar to the proportions found in the general audits. This suggests there is a particular reluctance to prescribe beta blockers to patients with COPD, and more work is required to explore the reasons behind this apparent reluctance.